Hello, my name is Justina McGirt, and I am doing my final physical exam for Fayetteville State University. I'm nursing class 320. So we're going to get started. Before we entered the room with my patient here, we got her vital signs, temperature, heart rate, blood pressure, respirations. We also got her height, weight, and her BMI. And we also assessed her vision according to the Snellen chart. And she has 20/20 vision. So I'm going to get some hand sanitizer here, and we're going to get started. So Miss Oxenine, I'm just going to do a quick head to toe assessment on you. It might take around 30 minutes. I'm going to start with your head and then with your feet, okay? If you have any questions throughout it or any pain at all, you stop me and let me know. All right?
All right.
So we're going to start with the head. I'm inspecting it. The hair is fine, evenly distributed, palpating, no lesions, lumps or bumps noted. Okay. I'm assessing her face here. Eyebrows are symmetrical. Eyes are symmetrical. I am palpating the muscles here. Any pain?
No.
Okay. I'm going to palpate the temporal artery. And it is palpable. Okay. I'm going to inspect, palpate and percuss the sinuses. Just let me know if you have any pain, okay? The frontal, the maxillary here. Then we're going to palpate. Okay. Now we're going to assess her TMJ. I'm just going to have her, if you'll open and close your mouth for me, and move your bottom lip from side to side. Any pain?
No.
No popping noted during that assessment there. I'm going to assess her cranial nerve 5 and 7. If you will raise your eyebrows, symmetrical, clench your teeth, smile, clip your cheeks, and close your eyes for me. Okay? Then I'm going to get my cotton ball here. I want you to close your eyes, and I want you to tell me where you feel me touching you, okay?
Forehead, cheek,
Which cheek?
left, right cheek, chin.
Okay. All right, and then we're going to move along to her lymph nodes. The preocular, postocular, occipital, submental, submandibular, the jugular digastric, superficial cervical, the deep cervical chain here, posterior cervical, and then we have the supraclavicular lymph nodes. Okay, now we're going to do the ears. I am assessing or inspecting the external. Any pain?
No.
No drainage or lesions noted bilaterally. Okay, I am going to take my otoscope here, and I am going to look the canal, no lesions, no exudate noted. Okay, I'm going to assess the tympanic membrane. It is pearly white in color, concave in shape. And I'm going to go around and do the same on the right ear. And I'm going to be pulling up and out while doing this assessment here. The canal, no drainage noted, no lesions noted. Tympanic membrane is pearly white in color and concave in shape. There. Okay. Next, I am going to do the Weber Nines test here with my tuning fork. Okay, Miss Oxenine, what I'm going to do is I'm going to hit this, place it on your head, and I want you to tell me if you hear it in both ears or just one ear. Okay?
Okay.
You hear it in both ears? Okay? Next, I'm going to assess mastoid conduction and air conduction. What I'm going to do is I'm going to hit it, and I want you to tell me when you stop hearing it, okay?
Stop. Stop.
Okay, and I'm going to do the same on this side. Let me know when you stop hearing it.
Stop. Stop.
Okay. And air conduction was twice as long as mastoid conduction, and that is normal. Next, I'm going to do the whisper test. I'm going to whisper a few words, and I want you to tell me what I say, okay? If you'll cover your other ear and everything.
1, 2, 3, 4.
Okay. Cover this ear, and we're going to do the same here.
1, 2, 3, 4.
Okay. Next, we're going to move along to the eyes here. Her eyebrows are symmetrical. Her eyelids, lashes look good. The eyelashes are evenly distributed. I'm going to check the, and I'm going to put on some gloves here before I do this part. Okay. We're going to next assess the conjunctiva and sclera. The lower conjunctiva is pink in color, and the upper conjunctiva is pink in color as well. The sclera is white, no yellowish tint noted. We're going to get my ophthalmoscope here. Assess your lens, your cornea, and your fundus. If you just focus on a point on the wall there. No, the lens and cornea is clear. So, shine this light here in your eye, assessing the fundus and the optic disc. Orange is pink in color, and the blood vessels are noted. The same in this eye. Orange and pink in color, and blood vessels are normal. Okay, then we're going to check corneal light reflex. I'm going to shine this light from the side here. Okay. Then I'm going to get my pen light, and we're going to assess the Hirschberg. What I'm going to do is I'm going to shine my pen light on the bridge of her nose. And pupils are restricted there. Okay. I am going to, while I got my pen light, I'm going to assess pupil reflex. If we'll just focus on a point on the wall there, I'm going to shine this little light in your eye, just checking to make sure your pupils are constricted. And it did. And that one constricted as well. Okay. Next, I'm going to assess her peripheral vision. If you will cover your eye for me. Just let me know when you see my fingers, okay?
I see him. See him. I see him.
Okay, cover that one.
I see him. I see him. See him.
Okay. Peripheral vision is good. Okay, now I'm going to check near point convergence here. If you would just follow my finger in. Okay, and then accommodation, I want you to look at my finger, then look at the wall, and then look back at my finger, okay? Okay, you'll close your eyes for me. And lens are, they close symmetrically. Okay, next we'll go to your nose. I'm inspecting it. Septum is straight, non-deviated. Any pain? No. Okay, with my light here. I'm going to assess in, make sure the mucous membranes are pink and moist, and they are bilaterally. If you would close one nostril for me and breathe, and do the same on the other. Any problems with that?
No.
Checking the patency of each nostril. Okay, if you'll close your eye for me here. Close your eye. I am going to assess the olfactory cranial nerve. Cranial nerve 1, which is smell. If you'll just tell me what you smell here.
Cinnamon.
Okay, good. Alright. Next, we're going to move along to her mouth, the oral cavity. Looking at her lips, they are moist. I don't see any lesions, no swelling or anything noted there. I'll get my tongue blade, and I'm going to get my light here, okay? If you would say ah for me, I'm just going to press your tongue here. Tonsils are normal, no redness, no swelling noted. Gums, no swelling noted. Teeth, no dental caries noted. The mucosa is pink and moist. If you will say light, tight, and dynamite for me.
Light, tight, and dynamite.
Okay. And move your tongue from side. Stick your tongue out and move it from side to side. Okay, good. No halitosis noted to the breath. No cracking or hoarseness noted with the voice. She said light, tight, and dynamite. I'm going to also assess your soft and hard palate. Hard palate is bony. Soft palate is muscular. Is good. Okay. Now I'm going to move along to her neck. I'm inspecting it. No swelling noted. No lesions. Trachea is midline. Any pain here? No. Alright. And I would have her normally to lay down in the bed and raise the bed at a 45 degree angle. And what I would do is have her turn your head that way for me and assess for any jugular distension on both sides. You can turn your head that way and note if any is visible or non-visible. Okay, so if you would just push your head into my hand here, same with that hand, push it into my hand. I want you to shrug your shoulders. Okay, good. And I just want to do some range of motion on the neck area. If you'll look up for me, chin to chest, turn your head towards me, and turn to the other side. Any pain?
No.
Okay. Alright. Just going to get some hand sanitizer here. Stethoscope. Next, we're going to be taking a look at your lung and your chest area here. I am assessing respirations, and they are regular, unlabored. Okay, I am inspecting the chest wall, no lesions, no scars, noted there. Okay, what I'm going to do is I'm going to have you turn towards me. No, I'm sorry. If you would turn the other way. Okay. I'm going to check respiratory excursion here. We'll just take a deep breath. Okay, and that is equal. I'm just going to palpate. Any pain?
No.
Now we'll do the same interiorly, palpating. Okay, I'm going to check for tactile firmitus. If you'll just say 99 for me each time I place my hand, okay.
99, 99, 99, 99.
Okay. We'll do the same.
99, 99, 99, 99.
Okay, I'm just going to percuss. Any pain?
No.
Okay, and I'm going to assist for the costovertebral angle. I just want you to let me know if you feel any pain, okay?
Okay.
Any pain with that?
No.
Pain with that?
No.
Okay. When looking at her chest, the anterior aspect is wider than the depth, so that is normal. Next, I'm just going to auscultate breath sounds here. We'll just take a deep breath for me. Okay, and I'm going to do the same posteriorly. And breath sounds are clear in all lobes. Okay. Now, what I want you to do is you turn for me, and lay down with your head that way. I am going to assist the heart portion. First, I'm just going to palpate for the apical pulse, which would be underneath the left breast here. And it is palpable. And I'm going to go back and I'm going to palpate her carotid pulse as well, separately. Okay. And while I'm doing that, I'm going to auscultate the apical pulse while palpating the carotid. Those are equal. Next, I'm just going to listen to heart sounds here. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Moving along to the abdomen. There you go. I'm going to inspect the abdomen first for any lesions, scars, bumps. In a normal setting, we would lift the shirt for this part, but for this video, we will not. I would go on the right side of the bed with my light, and also at the foot of the bed. Okay. Next, I'm going to percuss in all 4 quadrants, starting at the right lower quadrant and working my way up and around. Any pain?
No.
Next, I'm going to palpate in the same direction, starting with light palpation. Pain?
No.
Deep palpation. Okay. Then we're going to move along to the muscular skeletal system here. We're going to do some range of motion. I'm going to do some range of motion with the wrists, fingers, the elbow, and the shoulder. I'm going to do the same with the other arm here, wrist, fingers, elbow, and shoulder. Any pain?
No.
Okay, we're going to do the lower extremities, range of motion. Knee, hip, knee, hip. Any pain?
No.
We're going to do some range of motion on the ankle, toes, bilaterally. I want you to press on my hands here. Okay, good, and pull back on them. All right, good. And while we're down here, I'm just going to assess the pedal pulse. Bilaterally. Posterior tibial pulse, which is on the inner aspect of the ankle here. Bilaterally. I'm also going to assess the popliteal. Okay. I'm going to assess your radial pulses as well. Alright, sit up for me. Turn feet this way. Okay. We're going to do some upper and lower extremity coordination here. We're going to do some digit touches. If you would take each finger and touch your thumbs. Go back from that way. Okay, good. And I want you to do the same with that hand. No problems there. We're going to do what is called a slap test. Sorry. Palms up on your thighs there. And just slap your thighs, turning them. Okay. No problems there. And if you would take your finger and go from my finger to your nose. Do the same with your other. Okay, good. Problems there. Lower, I want you to take your heel, your right heel, and run it down. I'm just going to adjust the camera here just so you can see here. Take your right heel and run it down your shin of your left leg. Starting up here. Just, yep. Place it right there and just run it down your shin. There you go. And I want you to do the same with your other. Okay. Alright, good. If you'll stand up for me. Turn towards that wall there. And if you're bending over and trying to touch your toes, I'm just going to assess your spine. Straight. No deviation noted. Okay, you stand back up. what I want you to do is just leave your arms to the side and close your eyes for me. That is the Romberg's test. No swaying noted during that. Okay. Now, back up for me to where I'm at. I want you to walk that way on your heels and come back towards me on your toes. Alright. If you'll just stand on your right foot and hop for me a few times and do the same with your left. Okay, good job. Turn that way. And we're going to do what is called some tandem walking. And what I want you to do is I want you to place one foot in front of the other like that and just walk to that table and back for me. Okay, good. Good. Alright, if you'll take a seat. One more thing I'm going to do, I'm going to get my reflex hammer here. And I am going to assess her reflexes. I'm going to assess the popliteal reflexes. Okay, and then with the other end of my hammer here, I'm going to check for Babinski, the Babinski sign. Starting with the heel, I'm going up. Good. The abnormality is noted there. Okay. This will conclude my assessment. Ms. Oxnard, you have any questions?
No, ma'am.
Okay, I will provide for privacy. Wash my hands. That's it.